first introduction, we'll all be aware of what are the things that we could know and we should know, which would better our practice. I'm sharing my screen as at now. Kindly give me a few minutes. Please, can you see my screen?
Yes, sir.
Great.
Yes, sir.
So, by way of introduction, my name is SWALLAH, Alhaji SWALLAH Suraka. I hold a BSc in sonography. I am a licensed registered medical sonographer. I have an MPhil in medical imaging and a postgraduate certificate in artificial intelligence in medical imaging. So I am hoping my credentials would help me to tutor you for this particular course. By way of objectives, you are supposed to, by this course, understand what ultrasound as an imaging modality is. We'll be talking about knobology, which actually deals with the ultrasound equipment and its usage. There are a lot of equipment knobs or buttons on the ultrasound machine that allows you to perform specific functions. So we'll be talking into details about these knobs and how they can help you get or attain what you want to attain during your examination, especially for diagnostic purposes. And then, of course, we'll talk about probe orientation. When you get your ultrasound machine, how do you orient your probe as placed on the patient with regards to what you are seeing on the ultrasound screen? We'll discuss that as well. Then, of course, we'll talk about pattern recognition and some of its terminologies in ultrasound. The pattern recognition makes us to understand what we are seeing and how to interpret them. Most of us would agree that if you have not done a scan before, or if you've seen an ultrasound image, it is usually in black and white. And how do we interpret those black and white images as reference to our human body? So why does the liver appear the way it appears? Why does the uterus appear the way it appears? And importantly for this lecture, why does the baby appear the way it appears? So we'll look at all of that. And to bolster that, you should know some of the terms that are used to describe what we see, so that it could be universally accepted. So if you are seeing something that is dark, how do you describe it so that everybody who is into that practice would be able to tell? How do you convert your knowledge into a report, what you've seen to a report, so that everybody would understand it as what you have seen? Just as communication through language allows us to understand what someone is specifically trying to tell us, our terminologies would give others, specifically the referring clinician, what please, if you have your mic on, you should turn it on. Thank you. So and it will help you describe specifically what you are seeing to your referring clinician. And if you are the referring clinician yourself, as most of you would be, then you would be able to communicate to your other colleagues specifically what you saw and what you are noting. In order for us to be able to understand what we will be seeing on ultrasound, we should first and foremost do a quick recap on what cross-sectional anatomy of the pelvis would look like. I am aware that you have all done some level of anatomy, but with regards to imaging, we usually go with cross-sectional anatomy instead of the usual systemic anatomy. So with this cross-sectional anatomy, we will be taking regions in the form of slides, because with imaging, we take slides of the body as superimposed. So we will be able to understand what structure lies on what structure.
Mommy recording it.
We will do that for the normal female pelvis. Then we will do that for OBS when the pelvic is gravid. So we will be discussing that into details and how these structures appear on ultrasound. Then, of course, after you are able to visualize and characterize the female pelvis, whether gravid or non-gravid, you would have to report on it. So we'll be dealing a little bit about report writing, and that would end the semester's work. Are we okay? Are we following?
Yes, sir.
Yes, sir.
Excellent.
Yes,
So what
Yes, sir.
is ultrasound? Basically, ultrasound is the use of sound waves that are of high frequency to create real-time images of the human body. Okay. So when you take the ultrasound probe, it is an equipment that contains certain materials, which we would come to later, that allows you to produce sound. So that particular material produces the sound after receiving the electrical energy that you have connected the machine to. So after producing the sound waves are of very high frequency. Medically, the frequency that we use for ultrasound practices for diagnostic purposes, although we have some for therapeutic purposes. For the benefit of this class, we will be dealing with the diagnostic purpose. We use between 2 to 15 megahertz. Again, if you are joining the class, kindly mute yourself. Only unmute yourself if you have a question to ask. Thank you. An ultrasound image would be created when the sound beam enters the body and then is reflected back. So when the sound beam enters the body, attenuation occurs. It interacts with your body. Some of it will be absorbed, some of it will be reflected, some of it will be diffracted, some would be refracted, depending on the body it interacts with. Whilst others would am I audible?
sir. Please, you are giving us feedback.
The feedback is coming from someone's phone, I think. So I think someone
Yeah,
is.
it's because some people have unmuted themselves. That is why. Please, if mute yourself.
Okay. So the sound beam will travel into your body. Let's see if we can find those people and then mute them by ourselves. The host can actually mute all others. So the sound beam would travel into the body, interact with the body, and then those that are reflected back. Okay. Although some would be diffracted, refracted, absorbed, and there's some medium would even transmit the ultrasound beam. Those that are reflected back are the ones that the equipment would pick up. Those are what we term as echoes. So when you enter a particular room which is very empty and hollow, if you shout you will get the feedback So that particular feedback that comes back, although may not be as loud as your first vibration or your first sound that you created, it would still give back a feedback. That particular feedback is what the equipment picks up. And when it picks up that returning echo, we amplify it because most of the time they are of lower energy. It is amplified and then interpreted in various modes. The mode that is usually being used or is commonest is the B mode, the black and white mode that we usually see. So basically, that is the principle underlining how the ultrasound equipment works. The image shown below illustrates the various frequencies and what we are able to perceive. So with regards to frequencies, anything below 20 Hz is infrasound. This infrasound is heard by animals such as the elephant. For human beings, we hear between 20 Hz to 20 kilohertz. All our sound frequencies that we are able to hear or that are audible to us are between this particular range. Above this range, human beings cannot hear, but animals such as the bat can hear above these frequencies. So when we say ultrasound, it is sound wave of frequency above 20 kilohertz. Okay, above 20 kilohertz. But you should note that the medically used ones for diagnostics are between 2 megahertz to about 50 megahertz. For therapeutic purposes, we go way above the 15 megahertz. There are two major uses of ultrasound. Like I was saying earlier, we have one, which is for diagnostic purposes. The diagnostic purposes are also grouped under various functions. First, we have for anatomical, and then the second one is functional ultrasound. So the anatomical ultrasound produces images for us to visualize. So you want to see the baby, you use anatomical ultrasound, which is under diagnostics, to visualize the baby. Whereas we have functional ultrasound. You want to see if there is perfusion. You want to see if there is blood flow within the umbilical cord, for instance, then which would help you be able to tell if there is distress or not. So umbilical artery Doppler studies is an example of a functional ultrasound under diagnostic uses. Then we have the therapeutic ultrasound. The therapeutic ultrasound does not produce images, unlike the diagnostic ultrasound. The therapeutic ultrasound helps modify or destroy tissues in the body as it interacts with it. So in modern times, we use ultrasound for ablations and other purposes such as dissolving blood clots, pushing tissues away, delivering drugs, and then heating up certain tissues for them to die off. So these are some of the uses of the therapeutic ultrasound. In some instances, some studies are showing that we can use the therapeutic ultrasound to destroy tissues such as tumor, blood supply to fibroids can be cut off using the therapeutic ultrasound. It is also important to note that with ultrasound, with either diagnostic or therapeutic, there are no invasions. Okay, we do not puncture the skin or invade through the skin. Then, of course, we move on to the types of ultrasound examination. There are different schools of thought have different ways of categorizing the types of ultrasound. Some say we have external and internal, whereas others go on to classify them in three: the external, the internal, and then the endoscopic. I am of the school of thought of the three. The external ones are usually done by putting the probe on the skin. So all ultrasound examinations where the probe or the transducer is placed on the skin of the patient is termed as an external ultrasound examination. An example is when you have a patient coming to your unit for an obstetric ultrasound examination. Most of them are performed by putting the probe on the abdomen of the patient to visualize. So that particular type of examination is the external. To give you a reference image, this particular exam being done here, where you have the probe on the woman's skin, that is the neck, is an external examination. Then we move on into the internal examination. The internal examination allows you to put or insert the probe into the body. So anytime you are inserting the probe into the body, you are doing an internal examination. A typical example is the transvaginal examination, where we put a part of the probe into the body and manipulate externally. Okay, we manipulate the probe externally. So a typical example, like I said, is a transvaginal examination or a transrectal examination, usually done for men to visualize their prostate. The transvaginal is usually done for women to examine their uterus and ovaries as well as their cervix more closely in a more resolved manner. We will get to the differences shortly. The last one of the three is the endoscopic. With regards to the endoscopic examination, the probe is attached to a long, thin, flexible tube, which is usually termed as an endoscope, and pass further into the body. So with this, we call it endoscopy. So endoscopy is usually done for patients in which we have to visualize very deep lying structures like the stomach or the sigmoid colon or the ascending colon or the rectum. Structures like this, we use endoscopy to visualize them. So those are the three major types of ultrasound examination. Some, like I said, some other school of thought add the endoscopic to the internal to make it under one particular type. Over here, you have images of the internal ultrasound examination being done, whereby the probe has been passed through the patient's private part to visualize specific areas of her pelvis. And here you have another demonstrating the endoscopy with the thin tube passed through the patient's mouth, through the esophagus to visualize specific structures within her digestive tract. To the advantages and disadvantages. There are several advantages of ultrasound and a lot of disadvantages as well. We do know that ultrasound is non-ionizing. As we want, when we say non-ionizing, it does not give out harmful radiation. So ultrasound does not give out harmful radiation, unlike its sister imaging modalities like CT and X-ray. It also produces images in real time. So as at the time you are performing the examination, what you see is what is actually going on within the person's body. Unlike some examinations whereby after you take the images and you are interpreting, you may be interpreting at a later date to what you are visualizing. So with ultrasound, at the time of interpretation, you are seeing what is actually going on. The next thing we will be talking about as an advantage is its safety for pregnant women. Because with regards to ultrasound, because it is non-ionizing and it's controlled, okay, it's controlled, we regard it to be a lot more safer for pregnant women compared to the other imaging modalities. X-ray sensitivities are not allowed on pregnant women as they are highly ionizing, whereas MRI may become a bit cluster for the patient because it's a gantry, it's a tube that you'll be putting you to. The patient may feel a bit of stress within that particular examination. So although we sometimes do MRIs for pregnant women, it is not the first point of contact. Then we have its highly portability. Most of us have seen ultrasound equipment that are very portable. In recent times, we have just the probes where you connect the probe to your smartphone via Bluetooth and then be using the equipment. The equipment would be a tiny thing like a MiFi device. So that would be your probe. You put your gel on the probe and then put on the patient, and it will send the images directly to your connected smartphone. So ultrasound equipment are very, very portable and can be sent anywhere and everywhere to perform specific examinations. Compared to other imaging modalities, they happen to be very, very cheap. Okay. And an average ultrasound examination now may cost you 150 cedis, whereas an average CT examination would cost you somewhere around 600 cedis. So the cost discrepancy is very high. The average MRI may cost you around 1,500 cedis. So comparing MRI to ultrasound, which could be used for pregnant women, we believe that the cost for the ultrasound is very, very moderate. For ultrasound, you are able to also get quantitative measurement of certain structures. Okay, so although you can get subjective information from ultrasound, there are so many objective information you can actually get. The BPD, for instance, can be specifically obtained. The female length can be specifically obtained. It is objective. You can actually measure it, and then it's repetitive. You can measure and then do it again and get it to be a similar value. Then, of course, we move on to some of the disadvantages. We are aware that ultrasound, or some of us may be aware that ultrasound is limited by penetration. Okay. So because we are using sound, and sound has a region it can travel to, and it also have mediums it travels best in, it is limited by our bodies. Patients who happen to be of very big body habitus by virtue of obesity are very likely to be suffering or would not be able to be examined comprehensively, and as such, certain skills and maneuvering would be required to be able to visualize certain structures for such patients. Please, if you have any questions, kindly jot it down. Whilst we wait for the end of the lecture, I would accept as many questions as possible after. So Anas, please do that for us. Poor penetration through bones and air. Because ultrasound is a wave, it has its own limitations in terms of transmitting and transportation. When you have fluid structures, okay, like air, because air moves in all directions and it attenuates the sound when it is
Hello,
produced.
sir. Please, it's not
Yes.
a question. Your voice is very low for us. Please, sir.
Okay, is it better?
It's lower. Please increase it small for us.
Hello, is that better?
No, sir. It's not better.
Because I happen to be shouting. Is it still not better? Is
It's
everybody
okay.
is everybody facing the same challenge?
Sir, please, it's okay.
Okay. So again, two of the mediums that ultrasound find it very difficult to propagate in are bone, which are very dense tissue, or air, which are so very undense. So when we take bones, for instance, they absorb all the ultrasound that is sent to it. So we'll get to its significance shortly. These are some of the other advantages and disadvantages which you can read at your own free time. So then we move on to ultrasound mechanics. Some of us are aware, or most of us are aware now, as I have said earlier, that ultrasound uses high frequency sound. How do we get the high frequency sounds? The high frequency sounds are obtained by some vibrating crystals known as the piezoelectric crystals. These piezoelectric crystals vibrate intermittently. So when they vibrate and produces the sound travels through the tissues and partly those that are reflected are then interpreted by the ultrasound machine, as I said before. The principle that underlines the production of the ultrasound is by piezoelectricity. So this is an image illustrating the interactions of an ultrasound. We have our transducer here. This flat surface happens to be our skin. So this transducer sends down the sound frequency into your body. When the sound interacts with your body, different phenomena occur. We have some reflecting back, we have some refracting, some would diffract, some would a lot. So this is what we term as scattering. You can have some reflect and all of that. So those that reflect back, the reflecting echoes are the ones that are useful to us. The reflecting echoes are those that are received again by the transducer and then sent to the control system to amplify and interpret on our skin in various, on our screen in various modes. The interaction is what we call attenuation. This has all been explained during our the previous slide, so you should take note. But what you should also take note for exam purposes are this. What are some of the crystals that are used within the ultrasound probe or transducer that deform to produce the ultrasound? The generic name is the piezoelectric crystals, but there are specific different types of crystals that are used. Kindly find out their names. Then we would move on to ultrasound modes. There are various modes that we have in ultrasound. What are the modes I'm referring to? From what I just said, when ultrasound is interpreted or received by the when ultrasound is received by the probe and is amplified by the system, it has to interpret the receiving or returning echoes in a particular way for you to see. There are various ways for you to visualize. The two main ways are the grayscale imaging and the Doppler imaging modes. The grayscale imaging mode also have subcomponent or subunits of image interpretation. The first one is the A mode. The A mode is the very first way by which ultrasound images were being interpreted. When ultrasound was invented and became a diagnostic tool, we commenced its usage in the form of A mode. A mode is still being used today. If you have all seen the ECG report, where we have the cardiac discretization in wave form, that is actually how the ultrasound equipment interprets images in the A mode. It produces it in the form of waves. Different body tissues and their densities are interpreted with different peaks on the ultrasound A mode. So the denser the tissue, the greater its peak. Whereas for the B mode, which is usually what we most frequently use, the black and white mode, the B actually stands for brightness, whereas the A stands for amplitude. So the A is the amplitude mode, whereas the B stands for bright mode or brightness mode. The B mode comes in different format as well. Under the B mode, the ultrasound image interprets the ultrasound images in terms of the densities of the body. So the denser the tissue, the brighter the image would appear. Whereas the less dense the tissue, the darker the image would appear. So if we take two structures within our body, since we are midwives, we would agree that amniotic fluid, which is liquid, is less dense than the baby's femur, which is going to be solid, and the bone. So these two structures are the two far ends of the grayscale in terms of B mode. The two far ends, what do I mean? I mean to say that when you have clear fluid structures, like the amniotic fluid, it is going to appear black on ultrasound. Whereas when you have highly dense materials like your bones, would also appear white on ultrasound. Anything between these two structures would be structures that are not so fluid and not so hard. And as such, the ultrasound equipment would also give an interpretation in terms of shades of gray. So that is from black to white. What color would be depicted between that would, not be so white, but not so black, because the structure is also not so dense, but also not so light. So that is how the ultrasound beam mode actually operates. So when you take an ultrasound image, or if you've seen an ultrasound image, you may have certain regions on that image appearing very black, whereas others will appear very white, and then some other areas would appear ash or in a form of gray, where some will be darker than the others. So that is the principle behind the B mode. I am hoping you are following. Okay. Hello. Are you following? Is there anybody here?
Yes.
We can
Yes,
hear you.
sir.
Take it again.
Yes, sir.
Take it
We can
again.
follow
Yes,
you.
sir.
Yes, sir. Take it again, please, sir.
Okay. So again, on the B mode, when we say B mode in ultrasound, we are referring to ultrasound images being interpreted on the brightness scale. When we say brightness scale, we mean from very black, pitch black, to very white, pure white. These particular illustrations of black and white are in reference to densities of structures. We are all aware of what a density is, are we not? How dense, how compact the structure is. So for instance, when I take your urinary bladder filled with urine, okay, it will not be as dense. It is comparable to a balloon filled with water. It will not be as dense or as compact as when I take your liver, which could also be compared to, say, yam. Are we following? Your liver would be more compact or more dense in terms of its tissue than your urinary bladder. Okay, so with that particular thinking, when the sound waves interact with these two structures, your liver, which is more dense, would appear a bit brighter than your urinary bladder, which is less dense. Are we following? Hello.
Hi.
We are following.
Yes, we are following.
Okay. So when you have an illustration like that, and if you have this understanding, you convert it to black and white. The structures that are less dense, those that are not supposed to be that hard, would appear more dark, whereas those that are hard would appear more white. So structures that are hardest in our body are the bones. You all agree? So those ones would appear whitest. So any structure you see that appears so white, then it's likely or most likely to be a bone. Then structures that appear pitch black are fluid-filled structures like the urinary bladder, which is containing urine. So urine would appear pitch black because it is I'm not going to use the ultrasound terms now, but it is going to appear pitch black, okay, because it is less dense. Water and urine are so less dense that they will appear pitch black. Similarly, your gallbladder content, okay, which is bile, would also appear pitch black on ultrasound. Anything between those two would be interpreted in a shade of gray. When I say shade of gray, it means anything between black and white, any color between black and white. So you have something that is almost ash or light ash, deep ash, and so on and so forth, depending on the body's density or the structure's density. So that is how the B mode works. So most of the time you ask, oh, why is this not coming in colored? Why is this not coming in this? That is the principle underlining the B mode. So it cannot actually come in colored as you want it to. There are other equipments that show it better. Okay. And that is what we are moving on to. We have what we call the 3D. Okay. So with regards to the B mode that I just described, there are 2D, 3D, and then 4D. Okay. The 2D is two-dimensional. 3D is three-dimensional, whereas 4D is four-dimensional. 2D is when you have the superimposition of a body tissue. To make you understand it in a layman's term, we have all watched cartoons at a point in our life. When you watch Tom and Jerry, the images of Tom and Jerry as it appear on your screen are usually 2D. You do not see the thickness of Tom nor the thickness of Jerry. I hope you are following. If you take your phone or anything and you look at it from its front view, you will be unable to see the sides. So you would see it as a mere structure. Whereas when you take that same phone and you turn it slightly to your left or right, you'll be able to add the width of it to your image. And that way you'll be seeing in a 3 dimension. To give you another typical example, we have all seen a square before. If I ask you to draw a square on a piece of paper, that particular square is a representation of 2D of a particular structure. If I ask you to draw a cube from that square, you will be forced to extend the corners of that particular square, as we used to do when we were in primary school, to draw a box. Okay, that particular box illustrates that square in a 3-dimensional mode. So the images that we usually see on our screen in ultrasound are 2D, they are superimposed. But we also have 3D ultrasound, which allows you to put form to that 2D image that you've seen. I hope I'm making sense. So 3D is what people usually visualize or see and say, oh, wait, there's Aqualano. Because that particular 3D image reconstructs the entire fetus in 3 different dimensions: the X plane, the Y plane, and then the Z plane. That is what we term them mathematically or in physics. The X plane, the Y plane are what is used in 2D. Whereas when you add the Z plane, you are in 3D. So 3D gives width and then form to the baby. Then, of course, we have what we term 4D. 3D is an image, it's a single picture. When you have it in motion, okay, when you have it in motion, whereas you have it in a video form, then it is what we term 4D. Okay, so those are the 4-dimensional ultrasound. Then we have 3-dimensional ultrasound, then 2-dimensional ultrasound. So the black and white images that you usually receive or you usually see are 2-dimensional. When you go for 3D ultrasound, of which I'm sure some of you have seen or undergone, you would visualize that it is usually having a much more fuller form baby. Okay. And that is what the 3D is about. All these modalities that we've spoken about are under the grayscale imaging. Another one which is also under grayscale imaging is what we term the M mode. As midwives, there have been instances where we would want to record the fetus's cardiac activity. We may choose to use a fetoscope. We may choose to use other modes of identifying the cardiac activity. but I don't seem to think that any of these modes would give you as accurate as a result as the ultrasound M mode is going to. Because first and foremost, if you use the fetoscope, you may be hearing the activity of the abdominal aorta of the mother, and which may be interpreted as the fetus's cardiac activity. In situations whereby you have twins, you may not be able to isolate the various cardiac activities of the baby when you are recording cardiac activity blindly. With ultrasound, you are able to visualize specific structures and then get the specific readings you want. So if it is, for instance, twins, you can put your focus on a particular twin, say twin A or twin B, and then measure the heart of the twin A's cardiac activity. And the function that will allow you to do that is the M mode. When you put on the M mode, it records activity of structures. So the motion mode or the movement mode allows you to record activity of structures. Okay. So when you want to check cardiac activity, for instance, on ultrasound, which we'll be doing the practicals for during our practical session. So you shouldn't be too lost. Don't worry. When we are having our practical sessions, it would we'll have more hands-on for you to understand all of these terminologies much more easily. Okay. So the M mode is a function, just as we have said, and it allows you to record activity. Away from the grayscale imaging, we have what we call Doppler imaging. The Doppler imaging allows you to, as it is, record functional ultrasound activities. So if you remember our diagnostic uses of ultrasound, we spoke about anatomical and then we spoke about functional. The Doppler images allow you to take functional information from your images that you have visualized. Because sometimes you don't just want to see a structure. You want to see if that structure is performing its duty. So there are some Doppler imaging branches. We have one which is power Doppler. We have one which is color Doppler. We have the pulse wave Doppler. And we have the continuous wave Doppler. These are four of the main Doppler imagings that are performed. There are others, but for our benefit, we are leaving it at 4. The 4 have 2 of them, or 2 each, perform similar roles, but with different capacities. And the power Doppler allows you to record the presence of flow within a body tissue. So when there is flow, as in blood flowing through a particular tissue, you want to find out if this particular body part, there is blood going into it or not. You use power Doppler. If you want to see the direction of the blood flowing within a particular tissue, you use color Doppler. So when you have, say, a vessel in, say, your pelvic region, let's take the uterine artery. Then the uterine artery, you want to see if this uterine artery, is it actually supplying the uterus with the blood that is required? If you put color Doppler on that particular uterine artery, you would see that, there will be a flaring, there will be a notation or an image would depict to you that, this one there is flow, which is usually denoted in brown for power Doppler. It will be very brown. That particular region you select will appear very brown if there is flow, and 0, blank if there is no flow. There will be no coloring of that particular area. The color Doppler also allows you to see if there is blood flowing, but its ability to allow you to see if there is blood flowing there is 5 times less than the power Doppler. So if you really want to tell if there is flow in a structure, you use the power Doppler. Whereas if you want to tell maybe if there is flow, then you can use color Doppler. But the color Doppler is hello. Sorry, I received a call which disrupted my network. I'm sorry. So let's continue from where we were. So power Doppler, like I was saying, allows us to tell the viability of tissues or structures by virtue of telling us whether there is flow or not, flow of blood or not into that structure. It would also allow you to know this 5 times better than color Doppler would allow you to. Whereas color Doppler will tell you the direction of the flow. If there is blood flowing to it, is it going away from the tissue or coming to the tissue? That is in reference to arteries and veins. So is that structure that you are visualizing being supplied by a vein or an artery? That is the essence. And then the continuous wave Doppler. The pulsed wave Doppler, with this particular one, you have the ultrasound beam sending the waves in pulses. It will send one, then send another one, then send another one. So when it sends one, then it receives it before it sends and then receives, sends and receives. Whereas the continuous wave Doppler, the ultrasound equipment sends and receives at the same time. So it has one designated sender and then one designated receiver, where as you are sending the sound wave, another is receiving the sound wave. So it is always continuous. And then the pulse wave, you have one particular equipment doing the receiving and then the sending. So it will send first, receive, and then send another one. So you have the waves coming in pulses. Sends one, receive, sends one, receive, like that. So that is the various differences between the pulse wave and then the continuous wave. Their functions would be discussed in later sessions, most likely in the practical sessions, where its understanding will be made much more clearer. These are images that would depict some of the modalities. In this image, you are seeing color Doppler. Okay, so over here you are seeing blue and red and green structures. Okay, and here you have another image of the pulsed wave over here, and here is a 2D image of ultrasound, which that makes it a brightness mode. So this is a B mode, this is a pulsed wave Doppler, and this is the color Doppler. Images of the rest will be depicted to you during our practical sessions, whereby their understanding would be made clearer. We would move on to some of the actions that occur when we are in reference to ultrasound. We have what we term as frequency. Frequency is the when we look at our beginning of the lecture, we were describing ultrasound to be frequencies between 2 megahertz and 15 megahertz for diagnostic purposes. These frequencies detail or specify the type of probes you would be using. So we have different kinds of probes, and they all come with their various frequencies. The various frequencies determine the depth to which the ultrasound probe can penetrate. So when you have a 2 megahertz ultrasound probe, that particular probe can penetrate more than another probe which has 5 megahertz. When I say penetrate more, it means it can go deeper. So if, for instance, the 15 megahertz can only see up to the abdominal muscle of your body, looking at a fetus, then the 2 megahertz one would see past the abdominal muscle, go into the abdominal cavity proper, go into the uterus, and see the fetus, and even go far beyond the uterus to even visualize the maternal spine. So the depth is directional, the frequency and depth. When I say depth, I mean penetration. The frequency is inversely proportional to the depth. That is to say, the higher the frequency, the shorter the penetration. Whereas the shorter or the lower the frequency, the longer or the deeper the penetration. That is a principle you should understand. Another principle that you should understand is the relationship between depth and the resolution. For ultrasound, when there is greater penetration, there is poor resolution. When we say poor resolution, your ability to tell two structures distinct, anyway, only different things, two different separate structures. So when an image is more resolved, you are able to tell the various components of that image distinctly, clearly. So the greater the depth, the more structures you are visualizing, the less resolved the images would be. Whereas the more resolved the images are, the less depth there would be. Are we following? All right. So this is an image. A frequency of 3.5 megahertz, whereas this one is taken of a 7.5 megahertz. If we look at this particular image, it is taken of the human testis, and here would be the skin. Okay, the scrotal wall. You can visualize the entire scrotal wall and the structure clearly with the testis within it. Over here, you have the epididymis up here. So this is the testis. In this particular image, you have at the top here, the skin, subcutaneous tissue, rectus abdominis muscle, and then the peritoneum, all lumped up in this small structure here. Okay, because this structure you are seeing here is the liver. So above it are structures that lead from the liver all the way to the skin of the body. That is a lot. But you can see that it is not resolved because they are not distinct. You cannot see all of them different, because the frequency is low. So the lower the frequency, the greater the depth. You are seeing a lot more structures. This is the kidney, this is the liver, this is the diaphragm. All the structures you are seeing, but you are not seeing them distinctly. Whereas when you use the greater one, you see everything more clearly. and more resolved. So that is the very difference and the relationship between frequency, depth, and resolution. What are ultrasound used for? Some of the procedures we use ultrasound for are abdomen. We can use ultrasound for abdominal purposes. We can use ultrasound for cardiac purposes, which is termed cardiac ultrasound, obstetric ultrasound, as we are learning today, gynecological ultrasound. These two are the most common. Urological ultrasound, which although women perform, are mostly done for men by virtue of the prostate and its interaction with the urological system. Then we have vascular, the vascular ultrasound, where we visualize the blood flow in the various body parts. We can do for the abdominal aorta, the IVC, the portal vein. We can do for all the vessels in the body. Okay. Especially for the appendages, the lower and upper limb, when there are thrombosis and then clots in the blood vessels. We also do breast exams, which we emphasize mostly in October, the month of breast. And then we do some thyroid exam. We do for testes as well. And also musculoskeletal, when you have lesions in your muscles, skin, and then with your bones, we can actually use ultrasound to see some of them. Also for neonates, we do transfontanal and transcranial examinations. These are not all the exams we do, but these are the common ones. We do nerve ultrasound and others. But note some of the examinations or procedures that ultrasound can be used for clinically. Thank you very much for joining today's lecture. And then our question that we began is, why learn ultrasound? Why? I will end this by telling you why ultrasound is added to your curriculum. Okay. As midwives and as degree midwives as we are becoming, we should, most of us, find ourselves in clinical practice already. If you are to go or you are to come to school and you are to, as it is, improve on your knowledge, I think that knowledge and skills are the major reasons why one should further their education, especially with regards to skills. When you become a degree midwife, what can you do distinct or different from those that are not yet degree holders? There should be some form of skills that you acquire. I am sure the university has provided you with excellent and much more experienced midwives who would add on to your skills with regards to practicing midwifery. Okay. But in most instances, as a degree holder, you may be the lead or the head of a facility. And that facility may have an ultrasound machine or may require you to interpret ultrasound images as the senior most person. It is therefore important that you understand the ins and outs of ultrasound as it is practice, so that you would be able to apply yourself, get this skill, and you would be forever happy. I have been training with this institution for the last 3 years. Some of your senior colleagues that I have trained in this regard, when we have our practical sessions, really took it serious, and they are now practicing it at their various facilities. Some of them are being paid extra for this particular skills that they have, because although they are midwives and mid-husbands, they are practicing ultrasound, which is not particularly part of their job description. So their facilities pay them extra. So at the very least, you'll be paid extra for this. This is a skill that you can build on to further your skills and knowledge in medical imaging and ultrasound as a practice. So we feel that your understanding of this, although would help you skills-wise and financially, even in your practicing of midwifery, when you have the ultrasound equipment at your disposal, as many of you find yourself, there are some of you who have the equipment wasting away at your facilities. Whilst you have patients who need their placentation checked, who need their presentation confirmed, who need cardiac activity confirmed. All these things can be done easily within 2 minutes with an ultrasound machine. But here is the case, we do not have the skills and know-how to utilize them. So it is imperative that we take this course serious and try to understand it as much as we can, so as it will allow us to do well. Thank you very much, and I'll see you for our next lesson at another time. Thank you.
Thank you.
Thank
Thank
you,
you.
Thank
sir.
you.
Thank you, sir.
We are
Bye
grateful. Can we get slides?
God bless you.
May
You've
God
bye.
learned
Share
Please,
the
a lot
slide.
today. God bless you.
please,
Enjoy your
yours as
I will
well.
humbly share the slides with our HOD and course coordinator, and it will be shared with you.
Okay.
Thank you. Have a nice
Welcome.
morning.
Thank you, sir. God bless you.
Thank you.
We meet again next week. Bye.